One of our first items is roll call.
Helen Walker, Elizabeth Taylor, Richard Richardson,
Present.
Kathy Bowles, Gary Hajek, Russ Perkins, Liza Gulliver,
Present.
Sandra Murphy,
Present.
Casey Clark.
Here.
Our next item is the approval of the October 7th meetings.
Second.
All in favor?
Aye.
Our next is the approval of the November 13th set of minutes.
Second.
All in favor?
Aye.
And our next item is the approval of the work program outline that you'll find in your packet.
I would move that we would approve this with the caveat that things are going to be flexible at times. As long as we're all able to keep that in mind, but this is what we're going to strive for.
I'll second that.
Any further discussion? All in favor?
Aye.
And our next item is the outline of the senior service millage. Lynn is presenting. Keep in mind that she has a lot, she's cut down a lot of trees to provide us. So to try and keep on our timeline, please be mindful of our timeline.
All right, good afternoon, everybody. Let me make sure everybody can hear me. So what we're going to do is go through this PowerPoint presentation, and this is going to give you a very robust and detailed overview of the Genesee County Senior Millage. Please, at any time, if you need some clarification or have a follow-up question, please feel free to do that. In front of you, in wonderful ledger-sized paper, you have the full PowerPoint presentation as well as the maps so that you can really take a good look at those. Please hold. Okay, just a quick review. The Genesee County Department of Senior Services is dedicated to improving the health, safety, quality of life for seniors in Genesee County. The department oversees the distribution of senior millage dollars to area senior centers, contracted service providers, and to ensure quality services and programs for the senior citizens of Genesee County. Our 25-26 senior millage budget is projected to fund over $9 million in services and programs, including the senior centers within Genesee County to residents age 60 or older. This first slide, we're going to show, this was the initial senior millage ballot language that was on the August 2006 primary ballot. Shall the limitation of the total amount of taxes which may be imposed by Genesee County upon the property of the county be increased to 0.7 mils for the 10-year period of 2006 through 2015 for the purpose of supporting services to citizens 60 years or age or older. So this was the initial ballot language, and that did pass. It went before the August 2014 primary for renewal. We are actually in the last month of this first 10-year renewal. Same language. And then most recently, on the August 2025 ballot last year, with a rollback, and that's all calculated through equalization, the same millage was renewed for another 10 years, giving the senior millage funding through 2020 or 2035. So that will start in January. Yes. So that's an equalization calculation. There's something when the housing values are at a certain point, they have to roll it back. And that's a decision that equalization and the Board of Commissioners make.
That's a Headley amendment. That's just, it just rolls back. Yes.
So as you can see, the millage language has remained the same for each renewal from the initial and two. So we are going to be starting our second 10-year renewal. So this map, this is our census map. This shows all of the senior population within Genesee County. And again, you have the larger map, so I encourage you to take a look through there so you can see. So this is going to show the senior population based on our census throughout Genesee County. Next is our composite map. Every single dot on here, all 24,628 are senior millage recipients. Every single person on here receives some sort of senior millage funded service, whether that be in-home care, respite care, or senior visiting senior centers. So this shows throughout all of the county where we're servicing all of our seniors. Programs that currently the senior millage funds: adult daycare, ALS interpreter services, case management and assessment, confidential shredding and medication take-back events, elder abuse and exploitation prevention, personal care items, guardianship and conservatorship services, home delivered meals, information and referral internally, in-home personal care and homemaking services, in-home respite care, lawn care, and snow maintenance, legal assistance, medical transportation with a liaison program, notary public, senior project fresh market fresh, specialized senior programming, telephone intake screening, visually and hearing impaired services support, and the 16 area senior centers. So we have 3 snapshots here of the senior millage budget. This was back in 2010 and 2011. Broken down into the administration, senior center allocation, service provider allocation, and other governmental charges. Then we jump up to fiscal year 2020, 2021 with the same categories, as well as our current fiscal year budget. This is a breakdown from 2010 to 2015, the percentage of the allocation that goes to to the senior centers, the service providers, and then administration and governmental charges. Okay, so here we're going to go through our current fiscal year 25-26 budget. These are the senior centers. In 2005, a level 3, which we'll get into the breakdown of that a little later, received $206,330. This year, they received an increase of $10,316 for their total award to be $216,646. For our level 2s, in 2025, they had $137,923. They received a $6,896 increase for their budget award total to be $144,819. All of those remained with the increase. The annual audit remained the same at $45,000. What the annual audit is a contract requirement for all senior centers who are not tied to their local unit to have a financial audit. Over the years, these audits ranged from $4,000 to $15,000 per center. The senior millage decided, since it was a contract requirement, to put it out for bid so that we have one CPA firm that completes these audits at around between $4,100 and $4,800 per senior center that's tied to that. So it's kind of it's a contract requirement, but we cut the senior centers a little bit of a break by covering that for them. The G Card congregate meals was removed. That was a one-time, one-year contract to kind of help with the transition of carry-out meals, as well as encouraging more congregate style meals. So total for the senior center side, there was an increase of $44,536 to that budget.
Is there an audit process that goes for the senior service side, or is it just the senior center side?
All senior service providers receive financial audits themselves. There are some findings, nothing to be alarmed about or anything like that. And our auditors are actually quite good. They work with the center to give recommendations, but some of the requirements are just too large for these centers to do, but it's nothing that we have any concerns of any financial, yes.
Turn your microphone on. Sorry.
Could you explain? I'm talking to somebody who's behind me. That's the difficulty. I'd like to know. Like to better understand how it is that a initial budget was set for the senior centers that we've been building on since the first millage was passed.
So the first year the millage was passed was 2006. And there wasn't quite a plan in place of what to do with those dollars. So it sat. It wasn't until 2007 that the Board of Commissioners decided to start allocating those dollars. At that time, there still really wasn't a full plan in place until about 2009, when the Genesee County Metropolitan Planning Commission took over that. And they developed the framework for the funding. There was Board of Commissioners input, there was an advisory committee input, there were members of senior centers, there were members of service providers, all had that input of the initial formula, which was like a 33.1% to go to the senior centers of that total budget. So of the revenue, I should say. So then each year, it's just whether, and we'll get into the fund balance so you can see some fluctuation. So even in the really lean years, the senior centers and service providers did not receive an increase, but they did not receive also a decrease. So even through the lean years, they were able to maintain because of the use of the fund balance. Now, there was one year there was a decrease, and I'll be completely honest, that was just a political battle. Since then, they've maintained the level and then had three increases, I believe, in the past 5 years.
Okay, so I have a follow-up question. Given what you just stated, a senior center does not have to present a proposal or a budget to help us better understand an increase in operating costs for them. They just are all across the board then given an increase.
They're given an increase, but then they have to amend their budget. And I do have, for all senior centers and service providers, I do have the detailed breakdown budgets if you are interested in those. So each senior center, they receive an award of up to $216,646. It's up to that senior center's governing body or governing board to have to make that budget and to pass that budget, which then comes to our office, which we oversee to make sure that everything that they're purchasing, buying, or using is reimbursable in those correct line items. And if there's not, we have a couple ways of dealing it. We can recommend a budget amendment to move line items, because sometimes we understand that October 1st, your budget needs may change February 3rd when your HVAC system goes out. So we do allow for those type of budgetaries, but they must fall within that. And sometimes things are just not reimbursable and we have to say no. We try to work with every single service provider and senior center to make sure they can use all of their monies, but we also want to make sure that it's being used correctly. So if you were to say, if you went out and bought $5,000 worth of computer equipment for the center, but you have nothing in your equipment line item, we're going to say, one, would you like to do a budget amendment? And would you like to move some monies from programming down to equipment so we can pay for that? If you don't want to do that, we suggest that you use other funding that you have to pay for that, or just the senior millage will not be reimbursing for that.
Has there been an increase in the number of senior centers and if there's additional senior centers in the future that, ask for to be part of this program, is it still held to that same overall percentage?
Well, let's see. So when I first started, we had 16 senior centers, and that included the 3 in the city of Flint with Pierce Park. Pierce Park closed, so for a while we had 15. And it wasn't until about 2.5 years ago that the Mundy Township Senior Center opened up. So that bumped us up to 16. So the money to fund for the first year, the partial year, came from the fund balance. And then again, we pull money from the fund balance so that at this point in time, we don't have to decrease the funding for the centers. So that's where the fund balance comes into place. Now, future centers, again, that's going to be a Board of Commissioner decision, but monies for that right now would come from the fund balance. It would not be taken from any of the current senior millage service providers or senior center awards.
Thank you.
I have a question. So the County Board of Commissioners closed Pierce Center, and that neighborhood has only aged since then. What happens if something like that occurs again?
So Pierce Park was closed by the city of Flint. They did not want to run that center. Now, I will say the county did have issue with that center. They were not in contract compliance. So instead of being bumped to a level 1, the city decided, you know what, we're just going to close that and focus on Brennan and Hasselbring. Then the city of Flint did not want to run Brennan and Hasselbring. Thankfully, the Brennan Senior Center Board was very strong, and they were able to go in and become their own nonprofit. So while the building that they're in is owned by the city, the Brennan Senior Citizen Corporation, Elm Park Corporation, runs that center within there. Now, sorry, I moved away from the microphone. Now, Hasselbring was a little different. Hasselbring did not have a strong board at all. So there were a number of senior center directors and myself that worked with them to become a nonprofit. So that's how they became the Hasselbring Senior Center, the nonprofit. And that's, if you've been following a bit of the drama, the senior millage funding is following the nonprofit no matter what building that they're in.
And I'm just concerned about when politics gets involved and the community gets hurt. What's in place that we can put in place where that doesn't happen? Because that neighborhood is just older and older. And so the centers are further away. So if you don't have transportation, which is an issue, et cetera, I just want to know what's in place that doesn't happen, even with the politics. We understand that. But who's protecting the seniors in that situation?
Well, what I can speak to what happened with Pierce had a very strong bridge club. East Side Senior Center welcomed and absorbed them and had the transportation, and they were able to continue their group. So I don't know if I can actually speak to an actual plan in place, because we would have to take a look at those seniors participating in that center and see what other centers are around that maybe could absorb some of those programs and use their own transportation to bring seniors to the new center. So again, that's a lot of collaboration. At this point, I do not forecast any senior centers having to close. We have funding through 2036. There's also other funding sources. So I don't see that happening, but that's always something to keep on our radar.
Ultimately, though, it's the local unit of government, right? It's and it can be like, if you want to think about local control, right? But if we've seen agencies that have struggled, and we've seen local units of government come in to help stabilize those agencies, like senior centers and stuff like that. So ultimately, that's it. I don't want to dissuade questions, but we also have about 57 more slides. So, as if we can keep kind of moving to get to those, and then and we can circle back on questions, and if we have more questions, we can also extend this into the next meeting too.
I have a question. Here's my question. You mentioned that it's about a 60-35 split between senior center funding and other providers,
Yes.
right in there,
Yes.
allocation. What went into determining the 35% split? I mean, was it based on population? What was that, just arbitrary? How did 60-35 or so come to be?
I will be completely honest with you. This was before my time. That all of that was before I started. I will say, up until the 17-18 contract, it was in the allocation policy that said the total allocation of senior millage funds for the 2016-17, 17-18 senior center program shall not exceed 33.1%. So at some point, there was the Board of Commissioners approved that allocation split. And as you can see, since then, it's slowly fluctuated, but it's increased, it's decreased, it's gone up and down.
Really don't have a clear understanding of how
Of all the research, how that happened, because none of the commissioners that approved that are no longer.
Right.
Yeah, so it's a little bit more
kind of
difficult.
arbitrary. That was my question. Is how
Yeah,
Thank you.
that's the $1 million question. If you can come up with that answer.
Well,
And that may be something when we start looking at recommendations is for the commissioners to revisit that policy.
well, to base it on something. I mean,
Right. But right now, that's the data that supports what it's been over throughout the years. So then the next section of our current budget is the service providers. Professional services contracts, that remain the same. That's for our shred events, our using the GIS department within the county to produce all these wonderful maps and data points for everybody. Our ramp construction was not renewed for this fiscal year. It was determined that due to the fund balance level that some strategic decreases needed to happen within the budget so that the fund balance could get up to what the fiscal services determined was an appropriate amount. So cuts had to be made. G-Card received a $150,000 deduction. That was a one-time purchase of new vehicles for that program. There was a reduction in guardianship and conservatorship of $40,000. That was because Family Service Agency was able to find additional funding to pay the payee piece of that program. Family Service home care. So this is where it gets a little, 2 slides. So during the RFP process, Family Service Agency was not renewed for that service. So that was eliminated at $715,000. But jump over here to Benson's Home Care, which is the new provider, they received that funding. So alternative elderly care, they received an increase. There was only 2 programs that received an increase besides the senior centers because we needed to care for the currently 350 in-home care clients being served. We needed a smooth transition, so we needed to increase to one of our service providers to help to maintain that care. We had a decrease in family service, the visually and hearing. That was to hopefully they can find different funding for different aids. And the medical transportation, currently there is not an appropriate vehicle to add to that fleet at this time, so we removed that.
It wasn't that I didn't hear you, Brad, but I just want to ask on the hearing aids for the Family Service Agency, they wrote a grant. How do we look at those grants? How do we look at and find out if, because that's one of the biggest services seniors aren't receiving in Genesee County, is hearing assistance. Visual, I think there's like 5 I know of that will do free vision exam and glasses. What about hearing?
So for hearing, I know Family Service Agency partners with the Lions Club for hearing aid assistance. And obviously our program too, we don't specifically pay for hearing aids, but I have a list of other things, amplifiers, Alexas, all of these sorts of aids that allow a senior to maintain in their home. Specifically, if you want to know about grants, I would reach out, or I can reach out to those service providers that are providing that service to see what other additional funding they have.
So I don't want to be misinterpreted. and what I really was trying to get by, we will talk in detail about these things in the presentation. So Lynn has slides that talk about the clients, where they live for all of these different service providers. So if you have a question, these are just summary tables. So if there's a question about hearing, or if there's a question about home delivery meals, case management, we have specific slides on that actual topic. So I just didn't want to misinterpret. We'll get there. There's plenty of time for that in our presentation.
The interpreter services stayed the same, as well as legal services. And I do want to put a caveat in there. Legal services of Eastern Michigan, not only do they serve the seniors right here in their downtown building, but they also go to 15 of the 16 senior centers to provide legal services in the centers. Our lawn program, we reduced by $65,000 because we were not going to buy another truck or equipment at this time. Adult daycare was reduced by $60,000 because the need for adult daycare is not as strong as it was pre-COVID. And based on that organization's spending habits, they weren't spending their money. So therefore, we took that and moved it to another program. A respite was, because of the RFP process, was moved to a different provider. So that $200,000 went from Michigan Community Services over to Binson's. Specialized grants remain the same. Specialized grants are smaller award amounts to the McCree Theater, as well as to Atlas Township Silver Foxes Group. And the other ones remain the same. There was, with Binson's, they had a partial contract because when you're transitioning 350 clients, sometimes the fiscal years just don't work out in our favor. So we had to combine 2 fiscal years to make sure that there was no break in service. So overall, for the service providers, there was a decrease of a little over $500,000. And finally, in administration, these are fixed costs that are determined by our fiscal services department in regards to insurance and benefits and health services and different type of things. And then we also have a VAAA local match that we put under administration. And then we have our advertising and miscellaneous. Everything that we produce is produced in-house. We're very proud of that because that does save a lot. So overall, there was a decrease in the administration of $53,000. Okay, funding breakdowns. This is what I alluded to about the fund balance. So due to circumstances outside of our control, fund balance numbers are not available for those first years due to transition of different programs. But as you can see, in each year, starting in 2010, there was less revenue than expenditures. So that means money was pulled from the fund balance to continue to maintain services and award amounts. It wasn't until we got to, where am I? It wasn't until we got to the start of the COVID years, 2019, 2020, where we had more revenue than expenditures, and the fund balance started to go up a bit. And as you can see here, again, we had more revenue during those COVID years when there were less services and programs, just because seniors were not wanting to be in the centers as much. They did not want to have social workers in their homes, those type of things. So we were actually able to boost the fund balance a bit. And in turn, we were actually able to provide increases and start some new programs. So there was actually some good that came out of COVID for the senior millage. Try to have a positive attitude with that. But as you can see, continuing now, we are still pulling from the fund balance to provide the quality programming and maintaining certain or all of the programs.
Thank you, Lynn. Is there language somewhere that talks about a certain amount needs to be in the fund balance? When would you, or what are the actual circumstances why you would have a fund balance?
So the fund balance would be if, let's say, the millage didn't renew. There needs to be about 3 months worth of dollars to phase out that funding, because you can't say to 547 people, I'm sorry, October 1, you will not receive a home delivered meal. So that's based on what fiscal services are that recommends. So we're pretty good because we know we're going through, another 10 years. So there can be a little give and take if we needed to pull. But really it's in the event something happens to the millage and it wasn't renewed. Okay. All right, now we're going to get into what is a senior center. Senior center is a community facility that provides programs, services, and social activities for older adults, typically 55 and up. These centers are designed to support healthy aging, social connection, and overall well-being. Many of the centers allow age 50 and 55 and older into their centers, the young seniors, but the senior millage will only pays for services for age 60 or better. Okay, so here we're going to break down the senior centers and their levels. We have currently have two levels right now. A level 2 center has been awarded $144,819. Their contract requirement is that they provide 6 educational services, 10 health, have daily meals or meal education, transportation available, 6 social services programming, and then volunteer support group, legal services, and health screening available. To be qualified for a level 2, you need to serve between 250 to 999 seniors per year. Unduplicated. Okay, so here are our level 2 budgets. We have 6 level 2s. Broken down into the main categories: administration, programming, operating, and equipment. And as I stated, I do have every senior center as well as service provider detailed budget available if you are interested in seeing a more detailed breakdown. And here are what you hear unduplicated counts a lot. So this is the numbers. Starting in the 1920, you can see each year these level 2 centers are meeting their qualifications. Some have done, really rebounded after COVID. Those COVID years were a little lean, but obviously they were not in any contract violation because we understand what the circumstances were going. You'll see an asterisk by Mundy because that was a partial year contract. Mundy Township came in the middle of the year, so they were awarded a partial contract. Therefore, they did not have to meet the 250 that year. But as you can see, they very much have met it the years after.
Lynn, I have a question.
Sure.
How is it that a center could have funding for admin and operating and no money for programming?
That would be they have other funding sources. This is just the senior millage piece of it. So many of the centers have other funding sources, and so they may say, you know what, we want to focus the millage on administration and operations, but we're going to take the other 2 categories, programming and equipment, from our CDBG or an United Way grant, something like that.
Then in the administrative dollars for the senior centers for a level 2, is it understood that with a level 2 funding for admin, that pays for one program coordinator and one center director or a portion of their salary? I mean, is it specific on what admin can be used for? And how many positions, or what does that?
Our department nor the Board of Commissioners has any authority over the staffing levels. So that's up to the authority, whether it's the local unit board or the governing board. So they're the ones. But we do say administration is salary, infringes, and all those different benefits. But it's up to each individual center's board to determine if they have a director or a deputy director or a program coordinator. We don't set those dollars. So it's very well in every center's rights. If they want to use 100% of it for administration, that's what they use it for. But then we just make sure that that's being spent correctly. Okay, our level 3, those are our biggest centers. This year's award is $216,646. With more money, there's more requirements. So they have to provide 10 education, 14 health, have the meals available, have the transportation available, have the 10 social services, and then the volunteer support, legal and health screenings. And their biggest difference also is they must serve 1,000 or more unduplicated participants.
So how is transportation? Is transportation free, or do the centers charge for transportation?
That depends on the center. Some of the centers provide free rides. Some provide a ride for $2, and some it's up to them. It's up to each individual center. And some don't have their own vans. Some use MTA. Others use other resources. They do have their own vehicles. It just must be available. So we never wanted to punish a center just because a center nobody needed transportation that day. It doesn't have to, it just has to be available.
How many senior center unduplicated clients were served with the senior center staffing dollar? I mean, the senior center dollars.
I want to say about 14,500.
I'm curious about the requirements. Are there times when a service provider would be working in cooperation with the senior center to deliver services, and so then there's opportunity for the senior center to also meet one of their requirements and the service provider is meeting their contract obligations?
Absolutely. That's especially with legal services. So Legal Services of Eastern Michigan is in the senior center. So they are providing those services to our seniors.
One more question. On the audit, are they looking at these numbers that you have in front of us when they're auditing program?
So there's two audits.
Okay.
So there's the financial audit that goes through the books, and then there's our program audit. So once or twice a year, me and my staff go out and take a look. They have a binder. We run my senior center stats to make sure that they're meeting these contract requirements. We also get monthly reports, so it's very easy, and we can run these reports at any time, so we can always ensure that they're in contract compliance. And I'm proud to say that we have nobody out of contract compliance, so that's a good thing. Okay, here are the level 3 centers budgets. Again, same as the level 2s, just broken down between administration, programming, operating, and equipment. And as I stated before, I have detailed budgets available if needed. This is just the snapshot. And we have 10 level 3s and 6 level 2 centers. And here are the unduplicated counts for each year. As I stated before, during the COVID years, it was a little leaner. There was less participation, but in no way, shape, or form were any of the centers penalized by this, because obviously we knew that we wanted to keep the seniors safe. So if they wanted to stay home, that's where they needed to be. But as you can see, all the centers have bounced back and have very, very good participation. Okay, now we're going to jump to the other side of the millage, which is the service provider pieces. A service provider is an individual organization that offers services designed to support older adults in maintaining their health, safety, independence, and quality of life. A key aspect of a senior service provider role is meeting the senior where they are, both literally and figuratively. This means providing care in the environment that best suits the senior's needs and respecting their individual abilities, preferences, cultural background, pace, and level of independence. So all of the senior millage service providers go through a request for proposal through the Genesee County Purchasing Department. So that is all run through there. They go out for bid every 3 years, and the Board of Commissioners has the opportunity to renew those contracts for another 2 years for a total of 3. But at any time, we can put out another request for proposal if there are issues or concerns. But again, everything is done through the procurement piece. If some of you remember the first meeting, I went through a very brief, on all the service providers. So now I'm going to break those down and show you some more numbers as well as hours of service. So for adult daycare, their contract award was for $180,000. They served 28 clients and had 7,910 hours of service. The wait list is currently at 4. The contract award was reduced to $120,000 due to the organization's spending habits, as well as a less of a need for that service after COVID. And then attached to every single one, that's where your maps come in. So each data point is a senior that received adult daycare service, and we will go back and forth for each of the service providers. Case management and assessment. Their award was a little over $293,000. They provided assessments and reassessments for 751 clients. And that award amount remained the same for this fiscal year.
Who does case management?
Right now, we have a contract with the Valley Area Agency on Aging. So there's where all of our case management clients are located, all 751 of them, all throughout the county. Telephone intake and screening referral. As stated before, this is where you start for senior millage services in the home. And this is another contract with Valley. So their award amount is the $251,000. They served 939 unduplicated clients, and the contract award remains the same. And there's a map of all of our 939 clients. Elder abuse and prevention.
Excuse me.
Yes, I'm sorry.
So this is the start point, the telephone intake screening. And then from there, obviously, people get figured out where they're going to go. Is there a number of how many calls came in that you weren't able to provide services for?
I don't have that right off the bat, but I can get that. And when we talk about intake, it's not just for senior millage. Same as with when we get information referral. We might get a call for our office just asking for a resource directory and a recommendation of a podiatrist. So that's not necessarily going to be counted with an address and put on a map, but it would be counted as an information referral. But I would have to pull that from Valley to know how many calls were then referred to a different program.
If you could provide that, it might also help us look at, is there any unmet needs in terms of, are people requesting a service that's not out there?
Absolutely.
Thank you.
Elder abuse and prevention, whoops, I touched something. Go back. Okay, their award amount is $500,000. They served 1,259 clients. They were at 30 different events talking about elder abuse and prevention. They received 143 LENS referrals, which basically a LENS is an in-home wellness check. And they served 189 warrants. And that award amount remained the same.
So this is a service that is also funded through state dollars, right? I mean, elder abuse, similar to child abuse, has got funding in the state budget to be able to provide these services across the state. And I'm curious about that only because I'm wondering, is this something that we're unable to get the adequate amount from the state because it's not there, or is this used as a local match to bring down other dollars?
So Adult Protective Services is the state program, and they are very, very overwhelmed. The case managers usually have anywhere from 60 to 90 cases. This is a specialized task force solely dedicated to investigating elder abuse and exploitation prevention through the Sheriff's Department. We're a very unique county that we have that we have 3 dedicated detectives for specifically seniors in Genesee County.
Sorry, this is so great. This is an opportunity for us, obviously, in the county, but is this the only money that they get?
There is another part of the Elder Abuse Task Force that receives funding from a GRACE grant. Please don't ask me what GRACE stands for right now, but they do receive those funding. But this is the senior millage portion that funds the elder abuse team. And I will have to say, at any time, we can call them and they will do a wellness check immediately on somebody out in the community. We're very lucky to have this service. It's unfortunate that it's needed, but we have a dedicated staff and a dedicated sheriff's department to this program. Correct.
So if someone dials 911 and they live in the city of Flint, is the sheriff going to come to that?
Well, it depends on what the call is. I mean, if the call is for elder abuse and prevention, I would say most likely our elder abuse team is going to be dispatched through however the triage works. It'll start through a paramedic, a Genesee County Sheriff paramedic coming through, with then the elder abuse task force followed close behind. Actually, our detectives are all plain clothed, and they drive unmarked cars.
Could we delve into that just a little more? I would like for you to find out, if I call 911 and I live in the city of, who's going to come to my door if I suspect elder?
Okay, specifically to elder abuse. Okay,
I have another question too
certainly.
about year over year over year over year, 189 warrants for 30 events. What has been the trend over the last decade, for example, or since COVID?
Elder abuse has increased.
What is there data on that?
I can certainly for a next meeting show the numbers of the increases of what we've had.
Because we're paying for prevention too. Mm-hmm. So if it's not going down, then we need to work with and find out what's causing it and get to the root cause of it.
Correct. And that's another, that's an environmental and mental health issue. As we know, abuse is cyclical. And until we break that cycle, unfortunately, elder abuse is going to continue. And that's why we love having them out for outreach at these events and at different conferences, so that people can be educated. And a lot of these in-home services that we provide, especially the respite care, by giving that care provider a break, you're reducing the risk of elder abuse. You're giving that provider a break. So all of these tie in. And again, it is up to, for all of us to, if we're going to end this, is we have to end the cycle. Same with child abuse. But very, very good questions. And yes, I will continue to get you the data. Unfortunately, we have an aging population that are aging. So there's more seniors, less resources, and abuse unfortunately happens. And not just physical abuse, we're talking exploitation as well. Thankfully, a lot of the credit unions and banks now are training their tellers to say, hey, if somebody walks in and is requesting $10,000 and there's an aide right behind them, let's question that and to make sure. And they're also educating on those scams as well. Even if there's not somebody, and if they're buying those Apple gift cards, nope. So again, it's continuation of learning as well as educating. So all throughout Genesee County. The prosecuting services, their contract award was $53,000. They served 661 clients. Again, this is part, so when our elder abuse teams gets those warrants and gets those people ready, they turn it over to our prosecutor to go to court. Throughout. And our probate services, so this is the team that provides guardian ad litem services and or reviews them to make sure that they're on the up and up. $85,000 award amount. They served 1,216 clients. And again, all spread throughout Genesee County. Guardianship and conservatorship. Contract award is for $300,000. Clients served 231. These are seniors that do not have appropriate family members that are able to help them make decisions. So professionals are assigned to them to take care of their finances and wishes. That contract was reduced by $40,000 because they were able to find a different funding source to pay the payee piece of it. Had some cost savings there. So same amount of clients, less dollars.
Is there a wait list for guardianship services?
At this point, right now, no.
Usually it always has been.
Yeah, I mean, that's been reported to us because those don't have to go through the intake and screening process. People for guardians can call directly to Family Service Agency, but I can double check on that number.
I have a question in terms of guardianship and conservatorship. The Michigan Department of Health and Human Services has a statute that caps the cost for guardianship at $89 per month per client. They don't enforce it per se, but when I look at some of these commercial or nonprofit, it looks like they're charging more than that cap. I think as a committee, we just need to be aware of that when we examine that particular.
So would you like us to do some research into that and come back
Yep.
with some information
Yeah.
for the next meeting? We can do that.
Who's the service provider for this?
We have a contract with Family Services Agency of Mid-Michigan.
And that's a nonprofit.
Correct.
Thank you.
Home delivered meals, one of our most needed services throughout the county. Their contract award for last year was $1.5 million. 576 clients were served with 200,000 meals. Again, it dropped down the 150,000 because last year there was a one-time award for vehicles. That wait list is at 99 right now.
Does the meals that are provided at the senior services, are they funded through senior services or not?
So G-Card provides the home delivered meals.
Okay.
G-Card also provides the congregate meals. The senior millage in the past has funded the congregate meals within the senior center. A number of years ago, before COVID, there was talk between myself and Valley that the need for home delivered meals was increasing. Now, Valley is required to spend a certain amount on home delivered meals, a certain amount on congregate meals. The millage, based on the approval of the commissioners, does not have that. So at the time, we moved the $350,000 that was funding the congregate meals in the centers over to the home delivered meals, and Valley then picked up the congregate meal cost in the center. So it was a transfer. Now, the senior millage has come in at times to help a transition, because when we had COVID, home deliver or congregate meals in the center stopped, but the seniors still needed the meals. So we converted to a to-go style. Some of you maybe even participated in that.
We did.
Yes. So as the emergency orders ended, we are required to go back to what a traditional congregate meal is. A lot of work had to be put in with the directors as G-Card to get those seniors back into that. So the senior millage has come in at times to kind of fill in some funding gaps to ensure that a senior is not going without meals, but also Valley can bill and G-Card can bill correctly for the state.
And there's also standards of number of people who participate in each senior center. They have to meet a certain number per month to continue that service without losing that service.
And we understand that sometimes a senior center might not have a strong meal program. It is what it is. So that's where we changed the contract to have meals available or nutritional education. So we also encouraged a combination, not just a G-Card meal, have some other sort of meal like a soup and salad bar, something like that to entice the senior. But the main importance was to get the seniors back eating together, congregating for that socialization and that mental health aspect. So there's two maps for meals. We have the home delivered meals assessment. This is where the social workers go out to ensure every 6 months that a senior still qualifies for for home delivered meals, that nothing in the home has changed, and then those are our actual clients that are served throughout the county. So there's two different components to that.
Push, all right. Anyways, for a time, my wife ran a program in Linden where they bought and fixed in-house meals. It was overwhelming. There were so many people there for the meals. It was unbelievable. I mean, I've seen as many as 25 people come in for lunch. But there was, it took a good cook, probably 6 or 8 hours a day to put that stuff together. And then my wife ran around shopping for all this stuff too. But if it's quality, people are going to show up.
Agreed. Agreed. And we also have to remember that in some of our centers, I can specifically speak to some of the members in Montrose, that's the only meal they receive a day. So we have to really be aware of that, of how important a congregate meal is, and at low cost. There's always a suggested donation, but a senior will never be denied a meal if they're not able to pay for that.
I've seen a lot of that come through. Because I'd be there for that and then play euchre afterwards.
The same is true for the home delivered meal program. I mean, that one's near and dear because some of these people see no one.
That is the only contact.
That's another set of eyes on those homebound people. When the delivery comes, they're saying, oh, well, because they have come and found people not living or someone fainted or had a heart attack. And so, I mean, it's a huge benefit because now you're seeing people that may not have been, may not have seen anyone that day. And that's another point of contact to ensure that they're okay at home.
Absolutely. And that's why they are, the drivers are not allowed to just drop off food. They have to hand the food to the senior. So, very important program. Another very popular and needed program is the in-home personal care and homemaking. This contract was for $1.1 million, and that is between two different providers. So we have two providers providing in-home services, but to different clients. This program is too large to just have one provider. Clients that were served were 542 for 37,134 hours. The contract award went up 75,000. That was due to our transition from Family Service Agency to Benson's. In the end, we will be able to serve more clients for less money. It's just in this transition until we get everybody, we'll be doing quite well. And hopefully we can work on this wait list. As you see, wait list for housekeeping is at 202, personal care is at 201. And please note that these numbers flex daily. How it goes up is obviously there's a need for it and people are screened and added. How it goes down is if somebody doesn't need that service anymore, passes away, go into assisted living, and then we have people immediately ready to start services. So that's a very fluid number.
Lynn,
Yes.
Have you seen the wait list for this type of service over the last 5 years? Has it been fairly consistent?
It's always in the hundreds, yes. And at times it's been up into 300-400. And that's when we actually brought in a second service provider because the one service provider just couldn't do it. And then by bringing in that additional service provider, we were able to cut on the wait list. But it's consistently between 175 and 220.
Calls in and say, I need this, and they're saying, well, we already have a wait list, and then they disconnect. Is that being captured also? Because that's a different number.
No, I mean, no matter what, we're adding you to the wait list. We're just very honest with you saying it could be 6 months, it could be 8 months. We don't know. But they're always added to the wait list. Calls are made to ensure that when they're coming up on the chute, when it's time for them in the queue, technically, social workers call to make sure nothing has changed in the home and that service is still needed.
Lynn, is there other avenues to receive home delivered meals other than just through the millage or valley?
First, private pay. So something like mom's meals. So if you are able, and that is something we also do, we do say to them, and we'll put you on the waiting list. Here are four pay options that you can do to maybe, until the home delivered meals through the millage put into place. But yes, we always give, mom's meals and all those different options. In-home respite care, I touched on this earlier as one of the ways that we are trying to prevent elder abuse within the home is giving that caregiver a break. That contract was for $200,000. The client served 49 for 6,083 hours. The wait list for that right now is at 50. The contract award is at $200,000. This is another one where we switched based on the RFP to Benson's, a new organization. We know that with the same amount of money, we will be able to give these seniors more hours and serve more clients. So hopefully in the next 3 months, we see the wait list go down so that we are serving more clients, but still a need in the county.
A suggestion? On that, it seems to me it might be worthwhile in adding another information there on hours of service and clients. If you were to break that down into, say, the number of, divide one into the other, how many hours they actually got help, the actual person. Is it
We receive that monthly. The service provider breaks down the client, how many hours they received with each worker. So we see that every single month.
I figured it out, it was 121 hours per client per year. That comes down to less than an hour a day.
Correct. It does not happen daily. It'll be like a 4-hour period, maybe once or twice a week, based on the need of the caregiver and the client. Every single client is different, so it's not a cookie cutter.
You got 50 on the wait list. I'm just thinking that there's a need for more money there if we're really going to prevent some of the elder abuse.
It's a needed program, absolutely. And the more people realize that having a professional come into the home for 4 or 5 hours to give that caregiver a break, whether it be to go get their hair done, to go have a massage, to go grocery shopping. We have one gentleman, he literally just naps. That is a time that he is safe, that he does not have to worry about his wife, that he can just take a nap. And if that's what it takes to prevent elder abuse, that's what we're going to continue to fight
It really
for.
comes down to, do we give a lot of people a little help, or do we give fewer people a lot of help? So, I mean, it really boils down to how we stretch these dollars to give a lot of people a little help.
And especially with the county aging, I think that's what we really have to pay attention to, is that we're only going to have more people that need help.
And I think there's other options. We've talked about volunteerism. It seems like there ought to be a way to bring on board more manpower, particularly some people that are unemployed, that elders that have the time and are healthy and willing to help, if maybe only need is some encouragement. So I think that's an area we want to look at.
Of our clients throughout the county. Lawn and snow maintenance contract award last year was $275,000. There are currently 226 homes receiving this service. We did have the contract reduction because another truck and equipment was not going to be purchased this fiscal year. Currently, we have 280 homes on the wait list. This has proved to be one of our most needed services based on volume and phone calls.
Lynn, how is who's the service provider for that? Is it
St.
one?
Luke's New Life Center.
So they, if I look at this map, they go all the way down into Benton.
There's 4 crews. Yes.
Just if folks aren't familiar with that program, it's also that they train what might be a chronically unemployed population to do these services. So it's a job training program as well, which is a double benefit. So glad we're using them. That's great.
We're very proud of this program. It's been a wonderful partnership. And just a little side note, some of the seniors are very much wanting to tip them, but we just encourage them to shower the men with baked goods. Legal services, our contract is for $329,000, served over 1,200 clients. The award amount remains the same. As I stated before, legal services, they provide free services for seniors in their downtown location, as well as in 15 of the 16 senior centers. And the one senior center that does not use legal services, they provide their own attorney. So they still are providing legal services, just not through Legal Services of Eastern Michigan. Medical transportation with a liaison. This is another newer program. When I say newer, the last 2 or 3 years that we have found to be very important and very much needed. That contract award is for $350,000. There were 1,314 rides provided last year. The amount is going down because there's not another approved appropriate vehicle for that program. At this time, we have 5 vehicles in that fleet. 4 of them are Tahoes. 2 of them are full rear cut conversion for wheelchair ramp access, and then we have a Chevy Equinox. Each month, about 100 rides are not able to be fulfilled because all 5 vehicles are taken for the day. We're working on some different ways to map this. We want to follow HIPAA guidelines, so we don't want to put places, the actual doctor's offices on there. So we're working. This is one of our newer maps, so that it's work in progress.
Is this through MTA or?
No, this is through Family Service Agency. So what we found, unfortunately, with MTA is it was not as reliable at times. But the biggest difference with this piece is many of our seniors were foregoing different preventative appointments like colonoscopies, upper GIs, anything that needed to be under sedation. They didn't have a son or a daughter or a church member or somebody to take them, to stay with them. So we developed this program. So when you know you have an appointment, you or your loved one calls, schedules the ride. That driver comes to your door, gets you, whether it's from the couch, the bed, wheelchair, into the vehicle, takes you to your appointment, stays with you the entire time, whether it's they just want you to stay in the car in the parking lot, whether they want you in the waiting room with them, or whether they want them actually in the medical or the doctor's office in the event maybe some bad news is going to be given. It's nice to have an extra pair of ears. They will then take you, if you have any pharmacy needs or nutritional needs, they will take you to the store and or pharmacy and then safely drop you off at home. That liaison never leaves your side throughout that entire medical appointment.
Lynn, you started the description by saying we developed this program. So how did you find out about the need, and how long has this been in place?
We started this, I want to say we are in our 3rd year. We did a pilot project because we were having some issues with seniors calling for transportation. Seniors are not comfortable using Uber or Lyft, those type of things. Unfortunately, the bus system is not as friendly for a senior. Your ride can be pricey, and this had the personal touch. There's nobody staying with that senior that entire time. So we saw that, I mean, we had phone calls to our office saying, I'm canceling my colonoscopy because I don't have somebody that can stay there with me. So we saw this as a need. We also know that many seniors who are in wheelchairs, there's not a wheelchair accessible vehicle to get them. That's why we have those 2 rear conversion cuts. So I will say, and I can bring them next time. We have wonderful testimonials and surveys from this program saying that this program has saved their life because they were able to get treatment for a melanoma that they had no idea that they had because they had to be put under sedation for it. So, I mean, it's such an important, we have to think that not every senior has somebody to take them and can stay. And I will say, I mean, even people, sometimes sons and daughters and spouses work. They can't always take off work to take their loved one. Now, we have not allowed dialysis trips because some of those at this point are 3 or 4. Yes? Or 3 or 4 times. So right now it is for medical transportation.
I think we've got 10 more slides to go through.
We're going. We're moving. All right. Visually and hearing impaired. So 215,000 is the award amount. Clients 101, and 688 assisted devices were given out. That was slightly reduced. There's our map. And please note that the visually and hearing impaired support groups are run and offered in senior centers. We offer 3 confidential shredding and recycling events a year throughout the county. The contract awarded for 2,900, we had 634 clients go through. This is a breakdown. We had our first event at Monday Miracle Commons, second one out in Flushing, and the third one out in Swartz Creek. So we offer these are contact drive-through confidential document shredding on site, as well as medication take-back. And the auditing for the senior centers, I spoke to those earlier. That is to ensure that the senior centers receive a financial audit each year, and that award amount remains at $45,000. We have specialized programming. We have a $10,000 contract with CAC for interpreter services for the Flint Deaf Senior Group, Silver Foxes out in Atlas Township, and senior programming within the McCree Theater.
What is Silver Foxes?
Silver Foxes is a senior group out in Atlas Township. They, that's what they call themselves.
Okay.
And so that shows where our client, the CAC clients are. Now, it does not look like there's 49 dots on there because it's not. There are a lot of couples on there, so they're in the same household. So previously funded throughout the years that are no longer funded right now, currently in this contract, ramp construction, congregate meals, MTA, veteran services, My Choice waiver, and intensive case management and deep clean services. And finally, the last slide is I did want to show our ramp construction. Even though we did not renew this contract, we had 49 clients served with brand new ramps built on their homes.
Who's the service provider for the ramps?
So we contracted with the Disability Network, who subcontracted with Access Builders to build the ramps.
Was that problematic?
So there were a couple things with that. We were not getting the supportive documentation that we were required. We were seeing elaborate $7,000, $8,000 wooden ramps put on homes that probably weren't worth that amount. We struggled with them we wanted them to use temporary ramps if it was just for a rehab, rather than these huge wood I mean, they're beautiful, don't get me wrong. It just, at the time, this was a program that we could reduce because, as I like to call them, it's a one and done. That senior is still getting served, got that ramp, but it's not an ongoing service.
Thank you.
That's what I have for you. Happy to take any questions if needed, if time allots.
On behalf of everybody, we wish to thank you, Lynn, for the wonderful presentation.
It was great. Richard, I have, I guess, 2 things, point of information that I'd like to suggest. One is I would be interested in having a composite list of what program services have wait lists and what does that wait list look like over the last maybe 4 or 5 years. Because we talked about wanting to identify potential needs and trends. So a wait list report of some sort might be helpful. The other thing is that I'm just mindful of, as I was looking at all of these maps and where the services are provided, really trying to know and understand the economic disparities within Genesee County, where we know we have poverty, where we have people who are at the middle income levels, where we have food deserts, that sort of thing. And I know some of that because of my prior work, but I'm not sure if everybody does, and that might be something down the road that we'd want to take a look at.
I would like for you to add in that list race as we look at Genesee County. You had talked each time we've met about the Greater Flint Health Coalition's reports. I finally got a copy of that. And it's interesting because as I look at the reports more and more, I don't see much about seniors at all. And of course, we're here because of this task force for seniors, but
There's a special component.
don't talk over.
Okay, I'm sorry.
I just
ahead.
feel that we have to just pay attention to the agencies that are providing data, because if I don't know to ask about seniors, I don't know to ask about them. And the reports are not reporting, and that's an important agency in the community, and they're not reporting about seniors. And I want to know why. Because we're an aging community, that's not new statistically. Brad's office has been talking about that for 20 years. I mean, we know that. So how can agencies present programs that don't include elders?
Can I respond?
Well, I wasn't accusing you,
Okay.
stopping you from responding. I just wanted you to wait till I was finished.
The report may not show, but there is a component in the Greater Flint Health Coalition, which they have healthy aging group focus groups going on, and it's linked.
Not in here.
It's not in there, but they are looking at it, and they are also advocating in terms of seniors, and in terms of services. They're also advocating in terms of medical components, in terms of trying to get more primary care. That's how come I suggested that we have that person who runs the healthy aging focus groups present what seniors are telling her as their needs.
And the reason I'm really interested in it is because the city of Flint just gave them $1 million. So I want to know a lot.
So is it possible for us to receive, of the people served in the millage, what was the average age? I mean, how many do we serve between 60 and 70 or whatever? And income, are these low income, or do you collect that information, Lynn, on income or not?
So there is no income requirement for senior millage funding. You, to be eligible, age 60 years or older, resident of Genesee County. But yes, to all the other demographics that you've requested, we do have, but we do not have income level.
And whether they live alone or they're...
We have that as well.
I mean, that's important. I mean, as people age, they're more likely to live by themselves. So, okay. And my next question is I didn't see anywhere in the millage language where there were priorities set. It was just a general keeping people safe. Is there anything that you're aware of that says, we are planning with these millage dollars, we hope to never have a waiting list for home delivered meals or in-home services? Is there any priority set for the dollars? Or it's just a 60-35 split?
It's based on need. But there's nothing written down that says this is the end goal. Of course, we would love to not have a waiting list for any of our in-home services. We would love that, but again, there's just not enough at this point. There's not enough funding. The millage, there is not enough revenue that could fill the needs of all of the seniors. But certainly, the goal of keeping a senior in their home for as long and as safe as possible is a goal of the senior millage, hence some of the in-home services.
The other thing that I'm aware of, and I don't know that there's a way to actually document this, is that if you look at it this way, it was presented, it looks like these services are in silos. And the reality is that there's an interdependent web I'm guessing, of somebody who comes in as intake, goes to case management, has home delivered meals, might need medical transportation, and then down the road needs their lawn cut, right? So that one individual family or person, which is a different way of looking at the service delivery than what senior centers do, because they, we all know we swipe our card and we're counted, and there's so many, units, and that number is then reportable as an individual. So I'm always trying to keep in mind the fact that it's highly unlikely that there is a senior that's getting only one of these services. Now, I may be completely wrong on that. They may be getting 2, they may be getting 6 or 7 during the course of the time that they're in this world. But, that the intensity and the cost per unit of those service providers is going to be a whole lot more than what we see at the senior centers. I look at senior centers as almost being primary prevention. If somebody's engaged with their senior center, they may very well never get to being isolated and in their homes by themselves. Who knows? But so it's not, I guess, again, for me, trying to understand that there's this web and not a silo of services that are being provided, I think is an important piece.
I'm curious about when the senior millage passes some funding on to, say, legal services or to the sheriff department, what are the demographics within those agencies of services that they provide? Because it could dissipate in terms of age or gender or race or location.
So I'm just trying to collect. So when we get to demographics, what I'm hearing is that you would like demographics for the information that we have today, kind of broken down, and we can work with Lynn to see what demographics we have that's reported as part of this process, and we can have that by the January meeting. We'll include that with the packet when it goes out, and we can spend a couple minutes if you want. Do you want us to spend some time on that agenda to talk about that demographics, or do you want it as an informational piece? We can follow up with that.
I think we should follow up. Do more on the demographic side. For example, how many seniors are 60 to 65? How many from 65 to 70? How many? And then so we can get some idea of what percentage of people are being served and what resources we have in the senior pipeline. The other thing I'd like to look at trends. I'm seeing statistics, but I'm not seeing trends. So this is for 1 year, and so I'd like to know how, for example, the number of hours of service for respite care has changed. Is that over the last decade or so? And also knowing the number of senior population, so is it changed percentage-wise, how the change has been? That type of information would be helpful.
Absolutely, we can do that.
Yeah, Richard, I'm looking at the agenda on the report layout. Did staff want us to recommend something, or do you have something for us to respond to?
So there was a question at the last meeting about the report and making sure that as we get to the end, we're not scrambling to do a report to the commissioners.
Yeah.
So I followed up with the Dale Wayhill, one of the commissioners, vice chair. The expectation, what we're going to do is compile as we go. We're going to compile this information, like this PowerPoint, the next PowerPoint, the next PowerPoint. So at each meeting, we're going to compile that data in. So as we do each meeting, we're actually building the report. And then when we get to the prioritization, we'll add that to it. So at the end, that will be the report, which is basically all the information that this group has
Presented here, can we also do
We'll put some front end language and some back end language to it and pretty it up. And yes, absolutely.
I'd like some information too. I'm not clear on how, you mentioned a web of services or something of that term. I'm not clear how the different groups that are involved with seniors, how we fit together, how each is funded. Some of them are obviously are getting funded from private insurance payments or from, but I've got, the Valley Area Agency, and then I'm seeing on this, the Genesee County Commission on Aging. I'm hearing there's a Saginaw Agency on Aging that got $1 million or something from some source. So I'm thinking there's a way that we can, knowing who's interested in helping us, where the money's coming from, that maybe we can find it and identify ways that one group can take over maybe a new area, another one another area, and change not the people, but what the services are provided as needs change. Education was mentioned as being something that's needed for service providers. Okay, then maybe that's an area that could be a one-time service that could be accounted for. I think looking long-term, not just this year, over the next 10 years, we might be able to make some gradual changes without creating fear in any agency that's helping us.
That's something we can look at, Russ, in terms of our recommendation. One of the things I think, too, is for those of us that go to senior centers, we know a lot of programming, but there's people out there who receive Meals on Wheels that they're so isolated, they don't know what the programs available for them are. And, again, it's the Valley Agency Aging in terms of their case management component that tries to take that individual and see what is out there in terms of services. There's going to be, spaces in which there is no service, and we're not going to be able to meet 100% of needs. But again, we need to go back to looking at the mission of this task force in terms of making recommendations of, how do we best spend this money, and what are those needs. It's at our point of time for the meeting. Can I get a motion for us to close the meeting?
Move to adjourn.
Second.
Okay, all in favor?
Aye.
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 Thank you, everyone. And again, thank you, Len, very much.
Christmas, everyone.